Vertigo is a series of symptoms that involve a sensation of motion, spinning, turning, falling, the room moving, you're moving, something's moving. We see a lot of it here at Carlson Ear, Nose, and Throat. Almost 600 patients a year we take care of for this kind of problem. It's a little bit challenging sometimes because it can also be, people can have some dizzy symptoms, which can be from other problems. But typically vertigo involves some kind of motion sensation. Some of the other symptoms also are lightheadedness, a floating sensation, nausea, vomiting, feeling of impending doom, etc. The diagnosis of vertigo is pretty complicated and should probably involve an ear, nose, and throat physician, someone who's really specializing in vertigo. The complication arises because there's 4 components to the balance system: the ears, the eyes, the posture sensation, and then the brain. We have a pretty set process to help discover what the source of the vertigo is. We have a detailed history form that we ask. We have an extensive physical examination that we use. We do a hearing test because the hearing nerve and balance nerve run side by side. And then most importantly, we do a balance test called visual nystagmography, which essentially is a test that involves looking at all those 4 components. And once we have all those tests in place, we can make a diagnosis. As I say, we see about 600 people a year. We help almost everybody that we see. The treatment option, of course, depends on what the real source of the problem is. Sometimes it can be an ear infection, which requires just antibiotics. Sometimes it can be a positional type vertigo where there's calcium particles floating around in the ear. That can involve some kind of maneuver to help move those calcium particles. Sometimes it can be a treatment with some kind of medicines. There's a problem called Meniere's disease, which is a salt imbalance inside the ear. And then sometimes it can be more testing, for example, an MRI or a CAT scan to discover if there's something a little more serious involved. From the treatment of vertigo, from the maneuvers that we do, or many times there's some physical therapy actually called vestibular therapy. And most people actually recover very nicely with these treatments, sometimes instantly, sometimes over a period of just a few weeks. Sometimes, for example, the Meniere's disease might be a lifetime of medical treatment, lifetime of salt avoidance, etc. Most important thing to know about vertigo is that it's a problem that can be helped. Many people we see have gone for 10 years, 15 years with a problem, thinking that they just can't be helped. They come here to Carlson Ear, Nose, and Throat. We do our vertigo workup. As I said, we help almost everybody that we see.